Sarah Teller. I'm one of the pelvic health physios from Queen's Hospital. We're going to do a short series of videos to try and help you with your pelvic health issues over the next few weeks with what's going on at the moment. So we start off with the pelvic floor. Your pelvic floor sits at the base of your pelvis. It comes from the back of the tailbone round to the front of the pubic bone. Okay, so if I take this, that's what it would look like. So from the tailbone to the front of the pubic bone. And as you can see, there's layers to it. It's much more complicated than just a hammock, but if we just remember that for now. You can see it comes around the back passage, the vagina, and the yellow bit, the urethra. Okay, so it goes around all three holes for women. Obviously men have one too, but not the middle part. And looking from the outside in, again, this is what's around the back of the anus, around the vagina, and again urethra. You're not going to feel it around that front bit there though. Okay, so coming on to pelvic floor exercises, there's a few ways we can try and describe how to do this. I'll give a few analogies to try and help prompt you to how to do it properly. If you're sitting or standing, just sit comfortably, however you like to sit, cross-legged like this, it doesn't really matter. But what I'd like to try and sort of say is you really want to tune into your holes. So you want to think about your back passage and your vagina, okay? So what you want to think about when you're sitting there is imagine trying to close around the back passage and the vagina, lift up inside and then relax. Okay, so it's as simple as that. It's not kind of a massive squeeze and lift. It's quite a small motion, but it should be strong and controlled. And then when you relax, you just let go, don't push down, and make sure it fully relaxes back out. So I like to think of it like a rose closing and opening, which is quite a nice analogy there. So there's two types of exercises when you're doing your pelvic floor. You've got the endurance ones where you're going to close, lift, like you're going up an elevator to the top floor. You hold and hold, ideally up to 10 seconds. Then you let go, make sure it's fully come back down, and you want to do 10 of them in a row, 3 times a day. And then the quick ones are where you go quick squeeze, lift, relax, 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 quick squeeze, relax. Okay, you might not be able to do 10 in a row of those, and you might not be able to hold for 10 seconds. That is absolutely fine. That is what you're going to work towards. So just see what you feel like you're able to do and work from there. Some cues, like if you go to relax after you're doing your holding ones and you don't feel it let go, it's probably let go a little bit before where you counted to. So just bear that in mind with the holding ones. And then same with the quick ones. If you feel like you can't lift it up, again, you might be reaching sort of 5, 6, not 10, but you will get there with practice. Okay, so ways of trying to do your pelvic floor exercise, like I said, you want to grip around the back. So you want to think about, imagine stopping yourself passing wind and gripping around the front, lifting inside. If you feel like you're bobbing up and down or you're squeezing your butt cheeks, that's actually not the correct technique. You're doing your gluteal muscles, which are not the right muscles. It's more underneath. Hence we say you really want to sort of sit there and tune into these holes. Other analogies that you can use, I quite like, imagine you had like little blueberry at each hole, trying to grip your blueberries, lift them up and let go. You can imagine spaghetti kind of sucking up, let go, a bit grim. That's another one. Imagine you as gripping around your partner, if you have a male partner, and you're going to grip around their penis with your vagina. That is another analogy as well. There's lots of ways to try it. Depending on how comfortable you are, you can have a look or a feel as well. If you really are struggling after this video, then a referral to come and see us would be ideal so we can check what you're doing as well. But I hope this video helps for now. Thank you.